The healthcare industry is rapidly changing. Nurses who receive a BSN degree can expect to be on the forefront of improving patient care, strengthening community health, and reducing the cost of healthcare.
We are going through a transformation in our healthcare system, and we're really going to be looking at moving care out of traditional places like the hospital and more into the community. A really landmark report came out from the Institute of Medicine in 2010 entitled The Future of Nursing. A stakeholder group was formed really to look at the recommendations of the Institute of Medicine and decide what Vermont should do. And they further endorsed the recommendation of having 80% of our nurses prepared at the baccalaureate level.
A key emphasis of a BSN program is to educate nurses in how to research best practices and find the answers that best help their patients. BSN programs help nurses gain the confidence to be change agents.
Now healthcare is changing so that the focus is on the community. To be able to function as a nurse in the community, you need to function independently. Your assessments have to be more rapid. The information that you give has to be tailored to the patient's level of understanding. It has to be measured to the patient's readiness, and you have to do it in a shorter length of time. So that requires advanced skills.
There's so many factors that come into play when you think about where somebody lives and how somebody lives. So my explanation of how they should think about reducing the sodium in their diet, I really have to understand, so how do they eat now? And what's available to them now? And it takes a lot of energy and thought into following a patient after they leave your facility, into thinking about how well they'll succeed in their own environment.
You also need to be a teacher. You need to be able to understand and empower the patient so that in the community, nurses need to have a whole new set of skills and tools to be able to help the patient adapt and stay healthy. So a nurse is involved in from prevention through end of life.
Taking care of patients in our healthcare system now is very complex. We have recognized that so much happens outside of the relationship a nurse has with a patient in the hospital. So we really have to consider the social determinants of health and what could we possibly do to keep the person out of the hospital, keep them healthy and out of the hospital.
Discover a BSN program that is right for you. For support and information about the BSN degree, visit vermontnursing.org.